if you've been told you need bypass surgery, a few things may be worth understanding before you give consent. When you're told that your arteries are blocked and need to be managed, there are actually 3 different treatment approaches which may be considered. And many patients may not always be aware of why one option is chosen over the others. Treatment option 1 is medical therapy, medicines alone, which means pills to reduce clotting risk, to lower cholesterol, to control BP and blood sugar, along with lifestyle changes, which include diet control, sufficient movement, and quitting smoking. What does this option do? 3 things. It slows the progress of arterial blockage, it reduces the risk of heart attack over time, and it controls or reduces symptoms. And what does this option not do? It does not remove existing blockages, and it does not eliminate risk. It only reduces it. Who is this option suitable for? 4 kinds of patients. Number 1, patients who are stable. And stable here is not about how the patient feels. It is a medical judgment to be made by the treating team, and it means that the patient's symptoms and heart function are predictable at the moment and not rapidly changing, and so no urgent intervention is necessary. Number 2, patients with mild or moderate blockage, which roughly means less than 50% blockage in the left main artery or less than 70% blockage in other arteries. These numbers are rough guides and not hard rules, and their significance depends on many medical factors which are best judged by a doctor. Number 3, patients who are very elderly or medically fragile, and again, these are factors which should be assessed clinically by a doctor. And finally, patients who choose not to undergo procedures for reasons which could be personal, cultural, spiritual, or to do with quality of life, including faith in alternate healing systems or a strong personal intuition. This choice is respected in medicine, and the key principle here is that consent includes the right to say yes and the right to say no. Treatment option 2 is catheter-based interventions, with or without stents. A thin tube with a balloon on its tip is passed through an artery at the wrist or the groin. The balloon is inflated to open up the blockage, and usually a metal stent is left behind to keep the blockage open. And what does this do? In suitable cases, it can restore blood flow quickly when a blockage is causing symptoms. And what does stenting not do so well? In patients with diabetes or complex blockage over multiple arteries, stents may be less durable long-term than bypass surgery. This means that in some patients, the treated artery can start getting blocked again over time, either because of tissue growth at the site of the stent or because new plaque starts building up elsewhere in the artery. And so, repeat procedures might be required over time. Also, in cases where the arterial blockage is complex or widespread, stents do not always improve survival, meaning that they may not always help the patient live longer compared to medicines alone or bypass surgery in those situations. Who is this procedure suitable for? 3 types of patients mainly. Patients with 1 or 2 blockages which are technically appropriate for stenting. They are often used in more complex blockages, but they are known for providing symptomatic relief rather than proven survival benefit. Patients who are non-diabetic or who have their diabetes well under control, and patients who need quick symptom relief or where the main goal is improving quality of life rather than proven long-term survival benefit. Stenting is typically accompanied by medicines, especially blood thinners, for a period of time to keep the stents open and to reduce complications. Treatment option 3, the most daunting option for many patients, bypass surgery. CABG or coronary artery bypass graft. In this procedure, new routes are created for blood to flow around the blocked arteries. Using arteries and or veins from other parts of the body. Most commonly the chest, the arm or the leg. What does this procedure do which is better than the other two? 3 things. Number 1, bypass grafts are less likely to get blocked again than stents, and so the likelihood of needing repeat procedures over time is less than for stents. Number 2, bypass surgery is associated with fewer future heart attacks than stenting for patients with widespread arterial blockage. And finally, CABG is associated with longer survival in select patients, especially those with widespread multi-vessel blockages or blockages in the left main artery, as well as many patients with diabetes. And why is this seen as the most daunting option? It is a longer and more invasive procedure. The recovery is longer and more difficult, and the upfront risk is much higher than in the other 2 procedures. So, which patients are suitable for this? Diabetics with multiple blockages, patients with blockages in their left main artery or in 3 or more coronary arteries, and patients whose overall health allows them to undergo major surgery. In real life, many patients receive a combination of medicines, stents and bypass surgery, depending on what's most suitable and effective for them. If this helped you understand your options better, do subscribe to Heart Health for Dummies. Over the next few weeks, I'll explain in simple, non-medical language who makes decisions when a blockage is found, which doctors get involved, who decides what, and where the patient has a say. When your cardiac tests are normal but your symptoms persist, what could it mean? And what can a person realistically do next? Which patient factors affect risk and recovery if a bypass surgery is needed? The different types and classifications of bypass surgeries. If there's a specific topic within this that you'd like me to cover, let me know in the comments. Also, a reminder that I'm not a doctor, so nothing in my videos should be taken as medical advice. This is strictly to help you understand your discussions with your treating team and not to replace them. Take care.